mother is pregnant in the village, and she is asked to come to the health center in good time to wait, because where she lives is far from where she can get help. So she and her guardian come to the health center to wait. When they arrive at the health center, they find that there is no guardian shelter. They are sleeping on the floor, in the corridor, or perhaps in a sheltered space open to the elements, waiting for their day. When labor starts, she gets a bed. The bed might be complete or partly complete. It might have a mattress, or it may have a mattress that is too short for the bed, or indeed the mattress is not in good condition. There is no Macintosh on top of the mattress, so she has to lay her black plastic sheet, which she has been told to bring, and put her chitenje on top of that. She goes into labor and she starts bleeding. The staff struggle to help her and realize that she needs care at a bigger hospital. They contact the district health office and they find that the ambulance is at Queen Elizabeth Hospital in Blantyre. So they have to wait for that ambulance to come back to the hospital and then move on to the health center. 5 or 6 hours later, she's picked up on her way to the referral center. She arrives there. She is helped. Mother and baby survive, but they've gone through a harrowing experience to give birth to life. But on the other hand, from a different health center, another mother is in the same situation, has to wait equally long or longer, arrives at Chikwawa District Hospital. The mother is helped, she survives, but 2 hours later, the baby passes on. There are too many variables because of the level of lack that is there. What is it we can do to make sure that birth outcomes and experiences are a lot better than they are? The Mothers Fun Run provides a platform that brings together different organizations and individuals to address exactly this problem. Nation Publications Limited, through the Mothers Fun Run, have now been to 17 different districts, bringing help to mothers and babies of those districts, aiming to change the birthing experience and outcomes, aiming to provide a better working environment for the health personnel working in those institutions. All of it aimed at ensuring that we do not lose mothers and babies unnecessarily. In this 18th year, I believe we're going to come together once again to do just that. Visits to Chikwawa District Hospital, Ngabu Community Hospital, Gaga, Maperera and Makuira health centers revealed a lot of issues to us. What we noted in these health facilities, which is what we have noted over the 17 years, is that health staff are doing an amazing job to help women and babies, but with very limited resources and in difficult circumstances. They work long hours because of staffing gaps. improvising all the time, using candles and phones for lighting where there is no electricity. In some cases, they provide help without the ease of using running water. And like you and I, they cannot just open a tap and access water. With the lack of equipment, they always have to think about what they're going to use next, like the back of the hand to check temperature, because there are no thermometers. Working under such circumstances, delivering such results is a very noble undertaking. Patients come to health centers seeking assistance. The expectation is that they're going to bring life in an environment that is conducive. In the visits to the health centers, we found that the kitchens are small, dilapidated structures where people cook their food. We found that areas that look like shade, sometimes without walls, without windows, are where the women sleep on the floor while waiting, not just the guardians, but also the expectant mothers. How do we change this situation? How do we ensure that women want to come to the health facility, feel comfortable to come to the health facility, feel welcomed by the environment of the health facility? Because only then will women come in time, and will we reduce some of the problems that come with late attendance to hospital service. Let us look at Gaga, for example. It took us 3 hours of riding on a very rough road to get to Gaga. The Chapananga Bridge was swept away by one of the cyclones, so it means the road there is cut. The way to get from Chikwawa District Hospital to Chapananga and beyond to serve the population is to cross the riverbed through water. That is possible in dry season. But as soon as there is rain, it means Gaga Health Center that we visited is cut off. But looking at the nature of the road, it is easier for patients at Gaga to go to Mwanza District Hospital for help. To do that, they have to go through Mozambique and back into Malawi. 9 p.m. the border closes. So they have to use the Tambani Road, which is an equally bad road, also 3 hours away from help. Looking at that situation, it is very clear that the solution is to ensure that Gaga is as well equipped and as independent as possible, but also to always ensure that there's easy ambulance access for Gaga. Gaga, yet again, is a good example of a facility that doesn't have electricity served properly. They have a solar system which works partially. It means that when the solar system is not working, they resort to candles and torches. And yet, 10 meters from the maternity wing, there is a transformer. One of the medical staff has been able to connect electricity to her house, but the hospital does not have electricity. Obviously, that leads to difficult working conditions, But at the same time, it limits the sort of equipment they can have and they can use because of lack of proper and consistent power. That impacts health service delivery. At Maguira, on the East Bank, we found that there was no running water. Imagine a woman leaves her house, comes to get health service, she gives birth to her child, and then has to go to a river 200 meters away to have a bath, to clean herself up. That is not acceptable, but that is what the women face. In most institutions, sterilization was found to be a problem. The equipment not big enough to contain the equipment to be sterilized in order to meet up with the demand of service. In some cases, having to rely on another health institution to help with sterilization. All those issues can be addressed by provision of electricity on one hand, but the right equipment on the other hand. Facilities lack basic vital signs equipment, BP cuffs, thermometers, and the like. They don't have working trolleys and wheelchairs. Therefore, moving patients from one point to another, ward to theatre, theatre to back to the ward, becomes a challenge. The beds are not adequate. Most don't have delivery beds. They don't have examination couches. All those are basic equipment that would make healthcare delivery easier for the medical staff. They don't have equipment such as resuscitators and oxygen concentrators. The level of lack or the gaps address small issues and address big issues. But when you bring all those issues together, we would be looking at providing equipment in those areas that makes a difference. The good news is that as we went around, we found that there are quite a few organizations providing assistance, but that is not enough. The other good news is that we've got healthcare providers willing to do the work, willing to go the extra mile to provide a service to these women and babies. The final good news is that we are providing a platform where you and I, where your organization and NPL can come together, provide the basics that are needed to make a difference. So we're asking you to share this information. We're asking you to donate. We're asking you to participate in the Mothers Fun Run activities to save that baby and that mother in Chikwawa District that needs our help. We have done it for other districts. I've got no doubt that we'll be able to come together and do it for Chikwawa. Let's work together.